Good morning, everyone, and welcome to the Physician Wellness Monthly Webinar Series. We're excited to bring this to you today. You can go to the next slide, Lindsay. We're going to continue to let people join us. Just a few housekeeping items before we get started today. Today's sessions will be an hour with time for a question and answer throughout the session. The webinar will be recorded for future viewing. Please note that participation in the webinar qualifies for free CME 1 credit, and the CME link will be provided at the end of the webinar. Any resources mentioned during today's call will be made available for the presentation or after the presentation. We encourage questions and comments. Please submit those using the chat function. If you would like your question to be anonymous, please select privately to send to Lindsay Hanlon only, and she will share it at the end. The speaker and planning committee have no relevant financial relationships to disclose. The Nebraska Medical Education Trust designates this webinar for a maximum of 1 CME credit. Physicians should claim only that 1 credit. Joint sponsorship of this activity has been planned and implemented in accordance with the essential areas and policies of the Accreditation Council for Continuing Medical Education through the joint sponsorship of the Nebraska Medical Education Trust and LifeBridge Nebraska. The Nebraska Medical Education Trust is accredited by the Nebraska Medical Association to provide continuing medical education for physicians. I am pleased to introduce our speaker for today, Dr. Joan Daughton, with Omaha Child and Adolescent Psychiatry. Dr. Daughton specializes in child and adolescent psychiatry, treating patients with a broad range of illnesses, including mood, anxiety, behavior, and developmental disorders. She attended Loyola University Stritch School of Medicine for medical school. She completed her general and adolescent psychiatry residency at the Creighton, Nebraska training program. Her interests include community outreach, LGBTQIA health issues, and school-based healthcare. Dr. Daughton sees patients in her private practice near 114th and Dodge. And I'm pleased to let this turn over to her now, and we're going to have a great discussion. Thanks, Dr. Daughton.
You are welcome. Thank you guys for having me. Let's see. There we go. I think everybody can hopefully see this now. And okay. So the goals for today, I'm trying to cover a lot today just to give you guys a lot of information and a lot of resources and food for thought, kind of. So we're going to review normal development and then things to kind of watch for throughout your child's childhood. We're going to go through good enough parenting recommendations, and then we'll talk about ways that you really can feel better about integrating work and personal life. So we'll go through development first. So, and some of this we all know, but I want to go through kind of what's normal and then talk about maybe some of the things to watch for. So 0 to 6 months is usually a pretty enjoyable time with infants. Lots of first smiles and learning to hold things and turning towards you and those kinds of things. A lot of issues that come up during this time for a child are often related to some physical difficulties. So maybe they are much more colicky or just seem uncomfortable, and maybe that's due to reflux or MSPI or other things going on with them. Certainly during this time, really the only mental health concern that you may be alerted to is if they're not interacting much, if they're not responding to you or others, they're not smiling. You may be initially seeing some first signs of autism or other developmental delays. And really the biggest goal during this time period, aside from meeting kind of their physical needs, is to talk to them a lot, interact with them a lot, engage. You can kind of mirror some of the things that they're doing, and just engage with them as much as you can. 7 to 12 months, we start to see a lot of motor growth for them, which is exciting. Fear of strangers is totally normal during this time. Being passed off to somebody that they don't know well, and being distressed by that makes total sense. Again, if you don't see some of the motor development progressing, that can be a cause for concern, or even some verbal delay, because you expect them to be cooing and making lots of noises and even starting to form some sorts of words. And again, just a lot of interaction is recommended. Again, mirroring a lot of what they say, playing games, easy games like peekaboo and that kind of stuff, just really engaging with them is important. 1 to 3 years, another time of major growth for them. They're imitating play. They're able to name things in books. Now they're putting words together. They should be having a multi-word vocabulary. They should absolutely be able to follow directions, name their body parts, climbing on things, running, kicking a ball. They can begin to be negative, refusing to do things, not wanting to do what you ask. Certainly, temper tantrums are a super normal part of this stage. If temper tantrums are severe and concerning, it would be, an excessive amount of time where it feels like they just cannot recover from them easily after some redirection or a quick timeout, or distracting them from what's upsetting them. If that doesn't seem to solve it, definitely if they're trying to hurt others or hurt themselves during the tantrums, that would be concerning. And this is the first time at this age that you may begin to wonder if your child has ADHD. Those symptoms can start appearing around age 3 to 4. And usually it's not so much the inattentive ADHD that becomes more obvious at this time. Usually it's the hyperactive impulsive ADHD. And kids at this age with hyperactive impulsive ADHD are unable to be maintained in daycares. They are so impulsive and, running from the daycare room. They're climbing constantly on things. They can't sit in the circle at daycare and listen to the books. And, they're impulsively taking things from other kids all of the time. And aggression can be a part of that too. I think they just have so much energy and impulsivity that it's hard for them to kind of stop and think before they're doing those things. Um, and during this time of development, really, we should all be encouraging kids to use their words, to tell us kind of what they're thinking and what's going on in their worlds. And really, we should be carrying on conversations with toddlers, even if they seem silly and they're hard to follow a little bit. We really should be engaging with them and enjoying kind of the time that we can spend with them. So 4 to 6 years, again, a lot of milestones are met here. So they're able to skip and hop on one foot. When they get to the point where they can walk down the stairs with alternating feet instead of the one stair at a time with both feet. They can draw a 3 to 6 part person. At this age, usually they really want to please other people. They want to follow directions, do things that make us proud, please their teachers, that kind of stuff. They should be able to, at this age, share and understand the concept of sharing, that everything isn't theirs anymore, and they should take turns, and they should be able to play simple board games and enjoy those. They should start to be able to throw and catch a ball. Definitely use please and thank you appropriately. Um, some of these things also are difficult during this time, including their mood can change quickly. That's totally normal at this age. Something doesn't go exactly the way they thought, or maybe somebody doesn't share with them and their mood can change very quickly because of that. And that's normal. And just allow them to kind of talk about what they're disappointed in, or what's causing kind of the mood change. Also during this time, there are a lot of fears that are very normal. Separation fears can be pretty normal unless they become extreme. So um, sometimes going to bed is a scary time at this age. They're afraid of the dark. They are afraid of monsters in the closet, those kinds of things. That's all pretty normal development. And so our job is to reassure them, make sure they have things in their bed, in their room that help them feel safe and comfortable. Maybe it's specific blankets or even a flashlight, or certain stuffed animals. A good bedtime routine helps calm a lot of those fears. Storms can be another source of fear or anxiety in kids this age that's pretty normal. And again, just reassurance, and here's kind of what we do if there's a major storm. This is how we take care of ourselves during a storm, and let them be a part of that. If it gets really severe, then you would start to notice that they're not able to function in the way that you want them to. Either they're not able to sleep without you in the room, or they can't sleep at all, even if you're in the room and you're trying to help them get to sleep. Or storms, they seem to be so kind of obsessed with what's going on in the storm, and can't be distracted and doing other things and kind of move on from the questions and anxiety there. Certainly, if moods get so extreme that they are yelling or screaming or crying or trying to hurt themselves or hurt others, then the fear has gotten more than what we kind of would expect at this age. Um, so we can start to see some anxiety symptoms at this age that we can watch for. Again, ADHD may be becoming more obvious at this age, where compared to other kids in their classrooms or friends, that they are not able to follow directions. They forget everything that everybody tells them to do. They can't sit still to pay attention to lessons, or even do something kind of enjoyable like sing a song or that kind of stuff. And so anxiety and ADHD are things that we may start noticing some more symptoms of around this age. Very normal for them to ask why all of the time. And it's kind of enjoyable to be able to give them answers if we know the answers to things. Um, and at this stage, we should start allowing them to make some choices, and giving them a couple of options for things when we can, that we're okay with no matter what they pick. That's exciting for them and kind of gives them a sense of control over some things, a sense of kind of empowerment in situations. And again, we should definitely be allowing them to ask questions about all sorts of things, talk about any feelings that they're having, so they can start to understand, when I feel like this, I can name it. I can name it I'm mad, or I can name I'm sad, or give some words to the feelings that they're having. And then 7 to 12 years. So now we've got permanent teeth erupting, pubescent changes are starting, growing pains can happen. Those can be emotional or physical. They may feel very tired. I have a lot of parents that and kids that say, I feel tired a lot of the time. And I do think sometimes that's just related to a lot of growth during this time, and they need breaks and making sure that they're getting good sleep. They should be getting a lot more involved in the household functioning at this point. So caring for pets, being able to load the dishwasher, do part of the laundry routine. They should be starting to participate in taking care of where they're living and taking care of others in the house. Kids this age should enjoy really active games, but also quieter games. And they start to understand time and can tell time. This is also the time where they start to think abstractly. And so you don't have to be as kind of straightforward with explanations about things. They can kind of start to think in the abstract. Um, and definitely this age, kids are really proud of school accomplishments or kind of accomplishments anywhere, sports, dance, etc. And so it's important to encourage kind of taking pride in themselves and what they're doing day to day. At these ages, we should start to even interact with them a little bit more as you would another adult. So explain kind of expectations before activities are happening. What's going to happen? What do you expect for them to behave like? What are their roles in the activity? Again, more and more control should be handed to them. So giving them options for what they want to do, how they want to handle certain moments, or which activities they want to be doing. Give them some choices that you're okay with them choosing, no matter what they choose. And always, but especially starting in this age range, we should be providing privacy for them, time that they have their own space. They're able to get themselves ready on their own, and so they should have privacy during all of that. Some kids start to journal at this age, and that should be something private for them that we're not involved in. Again, you want to promote more independence, letting them get ready on their own in the morning, make some more decisions, make their own lunch, get ready for bed on their own, figure out how they're going to manage homework that they have to do in the evenings. There should be more and more independence and kind of self-initiation. But then we also need to kind of define behavior limits during this time, and let them know our expectations at home, at school, etc., based on kind of our family expectations. A major fear at this age that is super normal is just kind of loss of control in their world, meaning like, if parents are going through stuff that is really difficult, that kind of touches on a major fear for them, that life doesn't feel as predictable as kind of expected, controlled. And that taps into a major fear during this time. They want to, at this age, really want to feel like things can be predictable. Reactions from adults and others can be predictable. At this age, certainly we can continue to see some of those ADHD symptoms playing a role. This age is often the first time that it becomes obvious that kids may have inattentive ADHD, because sometimes when in younger years, inattentive ADHD, you can kind of manage those symptoms fairly well, and kind of fly under the radar. But as you get older and have more responsibilities, sometimes those symptoms become more obvious. Difficulties following directions, losing focus easily, distracted very easily, losing things that you're surprised that they can't keep track of, needing tons of reminders, even for super routine things like, hey, in the morning, we're supposed to brush our teeth and comb your hair and get dressed, and you find yourself reminding them every morning of the same routine. Those could be signs of inattentive ADHD. Again, kids at this age may start to have different types of anxiety. Generalized anxiety would be kind of worrying about anything and everything, worrying about worst case scenario, kind of seeming like they're on edge all the time, and little things can kind of tip them over the edge and cause a lot of frustration or anger. Social anxiety can start to appear around this age, where They're really worried about what other people think of them. Am I saying the right things? Am I doing the right things? I feel like everybody's staring at me, and really put a lot of pressure on themselves for saying the right thing, making the right decision, and what, what do my friends think? What do my teachers think? Um, Kids can also start to show signs of OCD type anxiety where things have to be lined up a certain way. There's rituals that they require that other people do in the house or that they have to do. And there's a sense of if we don't do it this way, something is going to go horribly. Um, some kids at this age start to have intrusive thoughts where they are thinking things that they don't want to think about, but they can't get rid of them. Like, I feel like my parents are going to pass away today. And I know that's not true, but I can't get rid of that thought. Um, and that can be really tough for them to even describe, but also to figure out how to manage. This is also kind of the first age range where depression may start to appear. And at younger ages, depression um, sometimes looks different than in teenagers. So for younger kids, often they're able to enjoy activities, enjoy their friends, but then the majority of the time they just seem down. They're not looking forward to things. They have low motivation. They could be really irritable, have sleep disturbances, have appetite disturbances. Kids, even at this young of an age, can have thoughts like, I just wish I was dead. I don't want to be alive. Much more rarely, kids at this age would try to hurt themselves in some way. Um, but all of those symptoms of depression could start showing up around this time. Um, So, um, and then of course, kids with any developmental delays or autism, you may start noticing, especially kids with high functioning autism, that they just aren't connecting as well with other kids their age. It's really hard for them to develop friendships and seem to kind of get close to a few kids at school or in other activities. Kids with high functioning autism sometimes can be very rigid. Everything is very black and white. Um, they are very focused on fairness and rules, and that everybody kind of needs to follow. They can still have kind of stereotype behaviors, or like hand flapping or jumping up and down if they get nervous or excited. Um, Kids with high functioning autism can get really focused and learn all about one topic and want to talk about that kind of constantly, and then move on to another topic and want to talk about that constantly. Um, and so those are some of the things to kind of be watching for through this age range. So 12 to 18 years, I feel like a lot of times this is the time frame that parents feel like it's even harder to manage. And this is, so much physical growth for them during this time, which is hard to manage as a person. So your skeleton is growing, your muscle mass is growing, adipose tissue, your skin is growing. I mean, that's a lot to manage, just that. And then your reproductive system is maturing. You've got to kind of acknowledge and figure out that piece. Onset of menarche, nocturnal emissions in boys, and often, especially at the early stage, at the early end of this age range, kids feel super awkward with gross motor activity. And again, easy fatigue during this time. And again, related likely to growth spurts, which could be emotional or physical. Um, but they are able to use abstract thought much better, logic much better. They can really start thinking about hypothetical situations and how they would handle them. They should be developing more self-esteem, kind of figuring out who am I and what's my place in the family, at school, in the world. Um, they should be very interested in their own development and also confused by it. What is happening? Why is this happening? Those are really normal thoughts for them. And it is pretty normal to be critical about their own features and appearance. Of course, we kind of want to monitor that. We don't want that to get so severe that they stop doing things with friends, or they stop engaging in activities because they're afraid they're going to do something wrong, or they don't look right. I'm not going to go to the school dance because I am sure that this dress isn't good enough. My makeup isn't good enough. You don't want them missing out on activities because of those kind of fears or criticisms. They definitely should start to be interested in romantic attractions. And this is the balance, I think, during these years, that they really want to be independent and not have anybody tell them what to do, but they also don't want to lose all of the support that they have. And so they also want rules and guidelines and expectations. That really reduces a lot of anxiety for them. So this is the hard balance and kind of dance that we do all through teenage years as parents, with giving them enough kind of control in their lives, but also making sure that we're there to support them. I sometimes picture parenting when when you go bowling and they put up the kids' bumpers down the lane. I kind of picture that as parenting, that the ball is the kid kind of going through life. And if the ball makes it down there on its own, with some bumps against the side, the parents are the I don't know what those are called, but the guards along the side to say, nope, you got to keep going this way, or nope, come this way a little bit. And so especially kind of during these years, I think that concept is helpful. Um, Definitely during these years, we can see kind of any of the mental health difficulties. So ADHD, depression, anxiety, developmental delays that kids may be dealing with. Sometimes kids at this age are dealing with PTSD symptoms from things that have happened previously. But at this age, you really want to have them engaged in their life. And so giving them rationales, talking about why you have certain expectations and consequences is important. Again, encouraging lots of questions and interactions and engagement with each other. Privacy is very important at this age. And there's a balance with all of that. I know there's kind of a spectrum also with how parents manage privacy at this age, because kids have so many different ways to communicate with each other. Where 25 years ago, 20 years ago, we were just, parents could maybe listen outside a bedroom door to a phone conversation. But now some parents are monitoring texting and on Snapchat and Instagram and that kind of stuff. It's a lot to be monitoring, but they deserve a level of privacy as well. You definitely want to involve them in planning, decision making. Here's what's coming up for the family. What are your thoughts about how we should handle this? Let them be a part of everything. And again, this big message of allowing them to maintain control where possible. How do you want to handle your homework, your studying, what activities you get involved in, what friends you have? How are you going to pick the right friends for yourself? How do you know if people are good friends? Allow them to maintain as much control as possible over those things. I think this is a good place just to pause and say, any specific questions so far?
Have any in the chat yet?
Okay. So another part of this presentation, as I kind of met to figure out what I should talk about today, is just really this idea of balancing all of this. How do we, how are we really good physicians and really good parents at the same time? And this takes a ton of hard work. Really, we have to be intentional about a lot of the contents of our day. We need a lot of boundaries. We need to focus on kind of everybody's well-being at work and then everybody's well-being at home. We've got to make sure that we seek support when needed and just take good care of ourselves. I think a lot of what I found in the literature and what makes sense is also just giving ourselves grace. We didn't become physicians overnight, and learning how to balance life as a physician and a parent, it just takes patience, it takes practice. And we're gonna screw up, and that's totally fine. As long as we kind of say stop and say, like, wait a minute, what didn't go well with this, and how do I change it the next time? As parents, we really are supposed to be modeling life skills, our values, kind of resiliency, grit. And that's a lot to be modeling at home and throughout our days. Moms are still bearing the majority of childcare. That's just a fact. It's definitely improving. But I think moms have to think about this even potentially a little bit more than dads. Um, Physician parents, it's clear we are more likely to experience work-life imbalance because of our workloads and because of our schedules can be super unpredictable depending on what kind of medicine we practice. Most physicians also, we work a lot, 40 to 60 hours a week, sometimes up to 80 hours a week. So this is hard work. This isn't supposed to be something super straightforward and easy and like, why don't you get it already? This is super easy to manage. That is not the concept. The other piece to some of this is just parenthood in general is hard. And often parenthood brings us kind of face to face with our own insecurities and doubts. Um, and that's hard to have to look at on a frequent basis. And kids also, I think, it's really normal for us to question, am I doing this right? What went wrong? How come that didn't turn out as well as I thought it would? And so we're questioning ourselves a lot during parenthood, which is totally normal, but that's hard work to deal with those questions. Um, and I think one of the keys is just showing up authentically, not pretending or trying to pretend that this is easy and we know everything. But being able to say to your kids, to your partners, to extended family, this is hard. And I'm struggling in this part. And then making sure some of the language in the literature is kind of healing our own wounds, but just taking good care of ourselves. And then we all know, then we're better physicians, we're better parents, etc. Um, and also just remembering that sometimes our kids really do know us well. And they can see a lot of what's going on in our lives and be open to that, be open to conversations about that. And recognizing when potentially some of your stress, your anxiety is spilling over kind of into their lives. Because truly, when things are not okay with us, kids especially can sense that in us. So, what kind of parenting works the best? I'm going to just kind of go over basics of this. So, if you guys want to read a lot more about authoritative parenting in all of the research, this is the approach to parenting that tends to work the best. That these kids have better grades, less anxiety and depression, higher self-esteem, they're more socially competent, more self-reliant, less antisocial. So, how do we do this? So a ton of positive reinforcement, which is hard sometimes. You want to say, I told you to take your shoes up to your room. Now that you didn't do that, here's the consequence. But positive reinforcement is really kind of one of the most important tools as a parent. And that can just be verbal positive reinforcement, but you want to be specific about it. Hey, I was really proud of you when you took your shoes up to your room right away. Be specific, name the thing that you're really proud of or excited about for them. You can do all sorts of positive reinforcement. There can be sticker charts and little things that they earn, tiny toys. I wouldn't go crazy with major purchases for positive reinforcement. even I find especially kids kind of 12 and under, but even older kids, one thing that kids love is one-on-one time with one of their parents as a positive reinforcement. So, if as soon as you get your homework done tonight, then we're going to go outside and shoot hoops. That's a big deal for kids. Or we're going to go for a walk, or let's go to lunch together, or let's go to a movie. Any one-on-one time with a parent is a wonderful reward for them. Authoritative parenting is effective commands. So we all get caught up in like saying things like, let's clean your room today. But what you really mean is you need to clean your room today. And so you've got to think about how you're communicating your expectations. So, and you need to be really specific. So instead of just clean your room today, you need to say, I want all your laundry up off the floor and in the basket. I need you to dust these two dressers. I need, be really specific, be effective with your commands. I think we learn this in medicine as well when we're talking with colleagues that we've got to be effective with our commands. We have to be specific about what we're asking people to do. So do the same thing at home. So then the chances of them doing it well and executing it well become way higher because it's very clear kind of what you're asking. Selective ignoring is a huge tool to use as a parent. For younger kids, like those temper tantrums, as much as you can ignore a lot of that, that's kind of one of your biggest tools for temper tantrums. And you can say, it's fine. I see that you're upset. I'm going to give you a little bit of time and then I'll come back and see how you're doing. As long as they're not destroying something, hurting themselves, trying to hurt other people, they can have a temper tantrum. That's okay. But you're going to ignore a lot of the demands or the screaming. And then they just learn like, wait, that's not an effective way to communicate what I need. And you can remind them, talk to me. What do you need right now? Or what's upsetting? Even ignoring some of the kind of sassier responses like in early teenage or late teenage years, and just not giving it any reaction can sometimes and often kind of get rid of certain behaviors that we don't want. And ignoring includes, so often we think of, okay, I won't say anything to them, but it also includes like, we can't roll our eyes then, we can't huff like, ugh, when something comes out of their mouth. So it's a true ignoring, like there is no response to whatever the behavior is in front of us. Scheduling, meaning try to have some structure to your days. So there's a routine in the morning, there's a routine in the evening. Here's kind of around the time that we all have dinner. Some structure to your days is helpful with in authoritative parenting. It doesn't have to be super strict, but just so there's some predictability in their days or their weeks or that kind of thing. Setting limits is important. Here's kind of expectations. Here's a line you can't cross, whether it's with how messy your room gets, what you need to do to put away dishes after dinner. If we're with family, here's the expectation. So set expectations and limits for things. Timeouts are a great strategy in authoritative parenting also, up to probably about age 10, depending on each child. And the general rule is the timeout should last as long as their age. And that's an easy way to remember it. So 3 minutes for a 3-year-old, 7 minutes for a 7-year-old. And the timeout really should be just time for them to collect themselves. It's not a go think about what you did and repent sort of thing. It is more go get yourself calm and then we can talk about things, because you want them to learn how to manage. It's okay to be really mad and upset or frustrated or any of those things, but you got to get to a point where you can calm down and then we can talk about how we're going to solve this moment. So timeouts really should be used as just get yourself to a point where you're not crying, where you're not screaming, etc. And then let's deal with this moment. Supervision is important in our kids' lives. So the more we know, the fewer risks kids take and the less emotional disturbance they suffer. This is a balance, though. It doesn't mean I'm monitoring every text that you send. I'm, hovering over everything you're doing at school and with friends and etc. This really is engaging with them so they're telling you all about what their life is like. And so ask them questions. What does this look like? Who do you sit with at lunch? What does it look like when you're out on the playground? What do you do at recess? The more you know about what's going on, they're going to be more engaged in their life and they're going to feel like they have good support. But it's not you kind of peeking in on their life through their texts or listening in on conversations. It's more being engaged, asking them questions, showing up at activities, etc. Also, we know that the more they're engaged in pro-social activities, school-based activities, volunteering, we know the less drug and risk-taking behavior they engage in. So also getting them involved in other activities is important. And then we have the truly the basics, which is sleep, exercise, and nutrition. And so as a parent, making sure that our kids are eating well, more whole foods, less processed foods, all of that. Making sure they're getting some exercise. This doesn't mean a rigorous exercise schedule necessarily, but if they're involved in dance or gymnastics or sports, or even if they'll go for a walk with you a few times a week, or some kind of exercise for sure improves cognition, academic development, etc. And then sleep is so big for all of us. And really, I think in general, kids typically need more sleep than they're getting, just in general. And so making sure that they're able to fall asleep well, stay asleep well is a huge piece, I think, that parents can both model and then help their children do. And then screen time. We could do a whole lecture on screen time. But really, you should limit screen time. They should not be on it constantly. A lot of families have certain times that kids can be on their screens. You've got from 5 to 6 p.m. every night, and after that, the screens get put away again. Or that you guys, I'm sure, all know there are limits. You can even schedule for different apps for iPads, for their phones, to turn off, turn on different things. But one of the biggest pieces is also knowing what they're engaging in online. And again, this doesn't mean watching over their shoulder the entire time, or having access to every app that they're on your own device and following what they're doing. Again, it means talking with them. Show me what you're doing on there. Tell me what that game is about. That's going to give you the most information without invading their privacy, but really showing them that you're concerned. You want to know what's going on, and then talking to them about online safety and any concerns that they have about being on a lot of the apps and social media. So here are kind of pitfalls with some parenting, and these may also sound, I mean, some of these descriptions can sound extreme, but I think we can think of ways in which we sometimes fall into these areas. And it's just areas to kind of avoid. So authoritarian parenting, you're really demanding. You don't respond much to their needs, their questions. And often there's just no negotiation, no explanation. This is how it is. I'm not going to tell you why. I'm the parent. You don't get to ask questions sort of approach. And these kids can be very compliant and obedient, but they may be experiencing fear of punishment, really have struggles with making their own decisions because they've been so used to someone just saying, this is how it is. I don't need your input. And there's definitely more potential for emotional or behavioral problems with this approach. Permissive parenting are parents who are kind of the opposite, where you are so responsive, so nurturing to your kids, which sounds great, but then there's just kind of no control, no expectations. And so there's none of those bumpers along the bowling alley are there. And so kids can kind of fall off, and parents are there to be emotionally supportive, but not say, hey, no, you can't be engaging on this app online. It's not safe. I'm not going to let you. That's the bumper that needs to be there. That in permissive parenting isn't there. You don't have a curfew, you don't have chores, you don't have a lot of responsibilities. So often these parents just kind of avoid conflict. There's no punishment for anything. There aren't a ton of rules. Kids navigate things independently, which is important in a lot of ways. You want them to develop their own decision-making and problem-solving skills, but they need the bumpers to say, I would maybe do it this way instead. And so then kids with permissive parents sometimes don't want to follow rules. They don't respect authority very well. And it's really hard for them to self-regulate because emotions have sort of been free flowing at home without any guidance for how to manage those. And then negligent parents are basically providing very basic necessities. So you've got food, shelter, you've got a ride to school, but otherwise I'm just not very available. And so not a lot of guidance, not a lot of discipline, but also not a lot of emotional support. You're kind of existing together, but not connecting at all. And sometimes in this approach, parents kind of are looking at their own needs much more than what does my child need at this point. Okay, any questions so far?
I did have a couple come in here real quick. One is I'm struggling to have authority when I ask my child to do something or not do something, and they don't listen to me as opposed to my spouse who's just able to be around more. Any suggestions?
So, I mean, part of that is, I think, first having a conversation with your spouse about how do we approach this? How do we kind of become more united on what the expectations are, what the consequences are for things, so that you guys are both kind of on the same page. Sometimes parents parent very differently, and kids start to respond to one parent in a different way than another parent. And neither may be a bad way of parenting, but kids may be used to a different way. If you feel at all like it's because there's not a great connection, because sometimes that's also the root of that, then I think also you've got to just start spending some more time with them. There's a type of therapy called parent-child interaction therapy, or PCIT, and it's meant for kids like age 4 to 7 with pretty significant behavior problems. And the first recommendation is to get down to their level, play on their level. Those are the first like several sessions of PCIT. It's child-directed play. And that is really connecting with your kid. And then you are able, once they see, oh, you can be in my world and you care about my world, now I can kind of respect what your expectations are and consequences are.
And then one other one we had real quick. How do you deal with mom guilt or dad guilt when missing important family moments?
So that's kind of what we're going to talk about next. And I'm realizing I'm taking a little bit more time. So I'll run through these next slides somewhat quickly because it's fairly obvious stuff, but really those are the questions to ask yourself. What are you guilty? What's making you feel guilty? And what would make that better next time? And how do I create kind of daily schedules and activities for myself that I feel like I'm really able to enjoy the things that I want to throughout the day, work, being at certain activities, etc. And you've got to give yourself grace that you are trying hard to make the best decisions for you and your family. And you can say to your kids, ugh, I hate that I missed that activity. And so next time I'm thinking about how I'm going to do it differently. And ask your kids, in what way do you want me to show up at that specific activity? Can you tell me about it afterwards? Can you take a video of certain things, or do you want me there? And then you can kind of rework your schedule for that. So how do we kind of start to balance everything? So a lot of this is really blocking off time. This is the time that I'm committing to work. This is the time that I'm committing for a family meal, for even for bedtime. You can block off time and say, from 7 to 7:30, I'm in the bedtime routine. I'm not thinking about anything else. It is really hard not to overcommit ourselves as physicians. Our culture is to commit to everything, give everything 110%, but often it's just not possible. And so we've got to be okay with saying no, or with saying I can't do that this year or this month or etc. Sometimes people make a to don't list, like these are the things I don't want to have interfere with family time. And then you can start kind of prioritizing things. A lot of the literature really recommends leave work at work. So before you leave work, finish your notes, answer your messages. Don't take all of that home with you because you're not going to be fully present when you're at home. If you can turn off work devices, turn them off. And then another key thing is really try to leave work on time, whatever that is for each of us, so that you're creating boundaries for yourself. And a lot of the literature talks about parenting might bleed into the workday. So maybe daycare calls or the school calls and your kid is sick, or you have to communicate with the teachers or etc. And that's okay, but try not to let work totally infiltrate at home. When you're home, when you're with your family, try to be with them. Some helpful things, and just thinking about like, how do I accomplish even just the really mundane tasks? So do I throw a load of laundry in every morning, and take it out every night? Do I load the dishwasher at night, for a few minutes? Do I do batch cooking? Should I get a grocery delivery service, a prepared meal service? Any ways to kind of make those really routine things easier for yourself. And then use your resources. Don't feel like you have to do this all by yourself. So delegate tasks at work and at home. Use extended family, use childcare options. There are a lot of support systems through public libraries, through religious activities, even playgrounds or like soccer teams are a great place to network with other parents and ask them, how do you handle this? Or could you take my child to and from soccer on these days, kind of thing. There are online support groups tailored to physician parents. I don't know of any local groups at this point. There's tons of parenting apps. And then even within our medical institutions, there can be childcare services, flexible scheduling. Talk to HR and ask them, what do you guys have available for physician parents? Self-care, we can't say this enough. Some of this is very straightforward, but make sure that you're doing something that is self-care related every day. And that could just be like making sure that you have a conversation about something that's not work and not family when you're at work. Enjoy conversations at work. Get yourself a little treat on the way home from work. And again, forgive yourself, remind yourself, I'm doing the best I can in this moment. And think about the things that you were grateful for about each day. Gratefulness is super helpful anyway, but to help you prioritize the next day. What went really well today? How do I make that happen again? And think about all the stuff that you are accomplishing each day. It's quite a feat, to get everybody ready, everybody to school, you to work. You work really hard. You take really good care of patients. You come home. You are making dinner. You're getting people to activities. That's a lot. Those are things you can be proud of that you accomplished each day. For sure, don't compare yourself to other parents. Everybody does this differently. Everybody has different approaches and things that they're dealing with. So that's not useful. For sure, consider we're also so programmed to think that we have to work 80 hours a week to be considered a good physician, that leaving work to go to an activity of our child's is looked down upon sometimes. Work should be your priority. If that's your priority, that is fine, but make sure you feel good about the choices that you're making. And we've got to adapt as our children grow, as we figure out our children's individual needs. Everything may change from year to year on what work looks like. The other thing that's very important is finding a job where you like your coworkers and you feel respected. Those are simple things, but if that's going well in your work day, then you're going to be more available at home also. Remembering that this is hard work, it's a marathon. There is no, sort of end point. And take care of yourself first. I think even remembering we are all pretty replaceable at work, no matter which role we are in, but we're not replaceable at home. And so, if things are not going well at home, you've got to focus there and say work's got to take a backseat. I think also just saying like both of these roles are incredibly important. And how do I kind of integrate? Balance sometimes feels like they're supposed to be 75% here and 25% here, or that kind of thing, or 50-50. And that's really not possible. And so you may be needing to integrate all of this. Like I said, you're at work from 7 to 11, and then you go have lunch with your child at school, and then you're back at work. There's some sort of integration throughout your day. Communicate with everyone, communicate with folks at work. When your home life, you don't have to give them details, but let them know, hey, I've really been struggling. My kid's not sleeping very well. I just got to let you guys know I may not be at the top of my game today. Can you help with such and such? Work with your partner at home if you have one. And then do regular check-ins with everybody. How's this going? Is this working for you? Do I need to do something different? Do you need to do something different? That's including your kids. Check in with them. How's this all going? And truly, sometimes we're going to have to make choices about our career that we didn't expect to make. Maybe you don't take a promotion that you were kind of expecting to take because the demands are going to be too high, and that integration of work and life is not going to be easy. Sometimes folks work part-time for a while, which again, historically can be very looked down upon in medicine. But you have to be able to say, this is what I deserve, this is what my family deserves, and connect with mentors, talk with other physicians who have been through this, and talk about what worked for them. Also, again, give yourself grace. Don't feel like you're supposed to know all of this just because you're a physician. And so reach out to your pediatrician, parenting books. I'm going to send you guys several books on how to handle certain like anger, temper tantrums, anxiety, etc. So turn to those kinds of parenting books, family, friends, etc. And I'm just going to say in this, either your days are going well and you feel like I nailed it today, or you're learning something about what you want to do differently next time. Don't feel like you're ever kind of failing. You're just learning about what needs to be different. So I'm going to stop there just to see, do we have any other questions?
Yes, I have a few that came in. One is, my 9-year-old has the intrusive thoughts that you described for this age. Do you recommend reassurance, or do kids outgrow this?
So sometimes they will outgrow it. And actually reassurance isn't the way to go, because then they just start seeking the reassurance. And so actually the best approach is trying to distract them from those thoughts and to say, you can name it, that's one of those goofy thoughts, or let the kid have a name for it, and then say, if you're having those thoughts, come tell me and let's play a board game, or let's go for a walk. Let's not let your mind make you focus on it. let's do something else to distract you from those thoughts.
Another one, I'm on call 24/7 every other week, so it's impossible to leave work at home. Not sure how to solve this problem.
So I think just during those weeks, I think communicate, like be clear with your family. Hey, this is the week where mom or dad has to really focus on what's going on at work a lot of the time. And so what can we build in during that week where potentially, I don't know if this is possible, but like 30 minutes each day or something, or 15 minutes, let's all sit down together, or let's go play a game outside, or let me create a small amount of family time during the weeks that you're on call 24/7. And then during the weeks that you're not, talk about what you guys want to make sure you're doing on those weeks so you really feel connected and present.
Any other questions? Feel free to come off mute and ask too. We did have one other one in the chat here. Can you speak briefly to grandparents' role or influence on grandchild development?
Yeah, and that was one of the questions from before. Use the village. Absolutely, if grandparents are available and present in town, or even on FaceTime or through letters, or absolutely, that's an important piece. The extended family is very important. Aunts and uncles, um, and can have a lot of influence on what a child's childhood kind of looks like. So use them, have your children be a part of their lives and vice versa.
Any other questions that we have? Well, I just wanted to share real quick. You mentioned the supports, Dr. Daughton, and I do want to mention that all of our LifeBridge coaches happen to also be parents themselves, so they're a great resource to connect with to start with. If you're starting with an issue and you want to talk it out with somebody who's maybe been there, definitely call in to any of our coaches, and their bios are on our website. And I just want to also note that we wouldn't be able to have all these without the support of our sustainability partners. So we appreciate all of their work they do to support LifeBridge. And also, Dr. Daughton, we just want to thank you for coming today and sharing your experience. I look forward to all of those books and resources you mentioned. Those will be shared on our website, which also has the recording of today's call, as well as the CME link that people can watch after. So we've got a bunch of thank yous in the comments for you.
Thank you all.
Thank you.
Forgotten.
Thank you.